Should just leave it on here.
Yeah, our technology, our website technology is ancient. Just be
Or should I be a question?
So unfortunately, you can watch it, it'll work, but usually we do chat.
So I should leave it muted. Okay, unless he tells me to unmute it. Okay,
Do
I'll
you
let
have the script up that we could edit?
Not here, it's in the studio, the conference.
Oh, on the teleprompter, okay.
Okay.
So maybe, add in that language submitting the.
So,
And then she can. Closing,
You should be hearing.
unless there's anything that you want added at the closing about.
I switched it to this one? Yes, one of
Yeah, let me change the input, audio input. How do I do that?
Before or after the show? Unless he tells me to. Okay, no, that's smart.
Yeah, that's gonna be programmed.
Did he talk to Jim? Okay. Did you catch that, Tom?
No, I didn't.
So,
I was hoping that you would hear the music coming through, but you're not.
no.
That's the mic.
Testing.
you and your family. I'm pleased to be joined by guest speakers representing 4 U.S. federal agencies that have been working together on this evolving.
Yeah, let me ask them. Tom, whoever's doing. Okay, good. So y'all are going to tell who the question is for. Do that, yeah. I'll find out. Yeah, if it's there, you're welcome to say it. Like
Okay.
if they know who the question's for, say, this is for Dr. Evil.
Yeah. Okay. Great.
Absolutely. Dr. Shaw. It sounds like they're going to do that.
Perfect. So then that just makes it more friendly, I
Yeah,
think.
it's fine.
Yeah.
Absolutely.
Okay.
Absolutely.
Great.
We'll check on all that.
And then time-wise, I don't need to sort of keep track. You'll just sort of push us along
I
and
haven't time for you there.
right. Okay.
I will probably give you the wrap up.
Okay.
Like what's is it questions at the end?
It's going to be in between. So we're going to do some questions that are geared toward the first 2 speakers, and then that will go on until I guess it says 12:30, and then I'll introduce the second 2 speakers.
So what's the last thing? You go back and you have some script at the end you need to read?
Yes. So
Okay.
after, then we'll do another bit of QA. So we'll have 2 sections of QA. The first session after the first 2 speakers, then I'll introduce the other 2 speakers. They'll talk about their representative agencies. Then I'll do another bit of QA from the audience questions, and then there'll be a 2-minute wrap up at the end as well.
That's you.
That's me.
You're doing the thing. Okay.
Yes.
Did Dr. Shaw say anything at the end? Or do you know?
I don't think so.
Okay. All right. Well, whatever. So what I'll probably do is either I'll hold up a sign or I'll give you the cue, and that means go into your final. Let that be the last question.
Right.
Is it questions before your?
So it's going to be questions.
I mean, right at the end.
Right at the end, yes.
Before your 2-minute thing.
Yeah, just questions again.
Okay.
Yeah.
So what I'll probably say is give you a wrap up signal. That means let that be the last question. You can say that's all the time we have for questions, whatever. I'm not sure what's in the script.
Okay, perfect.
And then go 3, stand by.
Hello, I'm Dr. Neha Pathak, WebMD's Chief Physician Editor for Health and Lifestyle Medicine. Thank you so much for joining us today. I'd like to welcome you to today's webinar, where we will talk about avian influenza, or bird flu, and the ongoing multi-state outbreak it is causing among dairy cows in the U.S. My hope is that by the end of our time together, you will have a better understanding of the current bird flu outbreak and what this means for the health of you and your family. I'm pleased to be joined by guest speakers representing 4 U.S. federal agencies that have been working together on this evolving situation: the Centers for Disease Control and Prevention, the U.S. Department of Agriculture, the Administration for Preparedness and Response, and the Food and Drug Administration. Our speakers will share what we know about the current outbreak, what we're still learning, and what is being done to protect the health and safety of Americans. During today's webinar, you can email questions to asklive@webmd.net. I would now like to introduce our first speaker, Dr. Eric Biebel, Deputy Assistant Secretary for USDA's Office of Congressional Relations.
Thank you, Dr. Ross. As you said, I am Eric Biebel, a Deputy Assistant Secretary with the U.S. Department of Agriculture. I'm also a large animal veterinarian with experience working with dairy cows. Today, I'm going to tell you a little bit about highly pathogenic avian influenza, sometimes called HPAI or H5N1, that was recently detected for the first time in dairy cattle. H5N1 is most often a disease of birds that USDA scientists understand well. It is spread by migrating birds and can be transmitted to our domestic poultry flocks. Think chickens and turkeys. USDA has responded to H5N1 poultry for the last 3 years, helping farmers keep their flocks healthy and exploring the possibility of developing a poultry vaccine should we consider emergency vaccination in the future. In early March, USDA received reports from veterinarians in the Texas Panhandle that some of the dairy cows that they were working with had become sick. The cows' milk production dropped suddenly, and the cows were generally not feeling well, but the veterinarians didn't know why. Well, those veterinarians did excellent work and a lot of testing before learning that the cows that they were working with had become sick with avian influenza. We've known that avian influenza can be transmitted from birds to mammals for decades, and we have seen sporadic infections of H5N1 in several species of wild animals and neonatal goats in one bird here in the United States. But this is the first time that we had seen H5N1 in dairy cows. Since that initial detection, USDA researchers, veterinarians in the field, and dairy producers have been working together to better understand how the disease moved from birds to cows, how it can spread within and between herds of cows, and how H5N1 affects cows that do get sick. While any new disease of cattle is of great concern to USDA, it's fortunate that H5N1 in cattle is a relatively mild disease. Cows that become sick with H5N1 generally recover after a few months of supportive care and can continue to produce milk. We also have very effective tests to detect H5N1 in cows because of our years of experience working with the disease in poultry and wild birds. So far, USDA has detected H5N1 in 49 dairy herds in 9 states. To put that into perspective, that's around 1% of dairy farms in the affected states and about 0.1% nationally. We know that the movement of cows shipped from the Panhandle region is responsible for the spread of H5N1 to different states. But we also know that H5N1 can spread within and sometimes between birds in a region. While we've learned a great deal about H5N1 in dairy cows, there are still many things that we do not know and need to learn. To help prevent the spread of H5N1 and to help us learn more about the disease, USDA put in place a federal order on April 29th. A federal order is a tool that USDA can use to limit the movement of animals to prevent the spread of an animal disease. Under this order, dairy farmers are required to test their cows before moving them across state lines so that we know those cows are H5N1 free and don't pose a risk to any new herd they might join. This is going to help prevent H5N1 from spreading. Another part of the federal order is a requirement that all testing done to detect the presence of H5N1 must be reported to USDA labs for confirmation. This is helping us to understand where the disease is spread so that we can work with farmers to help them put in place enhanced biosecurity measures and treat the cows that may become sick. Biosecurity measures mean practices that keep animals, workers, and farm operations safe, such as with extra cleaning of equipment or quarantining sick cows. Last week, USDA announced a series of supports for farmers that have affected herds to provide them with new tools to enhance biosecurity on their farms, protect themselves and their families and their workers, to reimburse them for the costs of veterinary care, and to compensate them for lost milk production. And of course, USDA is performing all of the tests on cattle prior to their movement or to confirm the health of a herd at no charge to farmers. Because H5N1 has been detected in dairy cattle, it's understandable that many people may be concerned about the safety of the milk and meat they buy for their family. I can say without reservation that our commercial milk and meat supplies are safe. At no time are animals that are sick from H5N1 or any other animal disease permitted to enter into our food supply. USDA and FDA share oversight of our nation's food safety system. USDA protects animal health and conducts continuous visual inspection of every animal that is destined for the meat supply. As part of their work, USDA inspection staff routinely sample products to make certain they are safe for people to eat. As part of USDA's response to HPAL, inspectors have conducted additional review of animals from affected herds and found no illness or disease and no virus present in meat. USDA has collected samples of tissues at the plants and submitted them to laboratories for additional testing, and again have detected no H5N1 virus. USDA has for many years conducted safety reviews of retail meat products, purchasing products from the meat departments at grocery stores across the country and submitting them for testing. Likewise, USDA has never detected H5N1 in meat sold at retail. Even though we're not detecting any virus in the meat, researchers at the Food Safety Inspection Service and Agricultural Research Service have been collaborating to test the effectiveness of cooking to kill H5N1 virus. As an experiment, they have taken a small amount of ground beef, which mostly comes from dairy cows, and in their laboratories have mixed that meat with virus cultures. They've then cooked those samples, as someone might do at home, and tested for the presence of the virus in what amounts to an experimental hamburger. As expected, the researchers have determined that cooking to an internal temperature of 145 or above is sufficient to eliminate all traces of this artificially introduced virus created in the laboratory for the purpose of this experiment. Similarly, FDA works with state authorities to test and ensure the safety, wholesomeness, and quality of our commercial milk supply. FDA has conducted samples of the commercial milk supply and have detected H5N1 in raw milk, which is expected, but also determined the pasteurization process, where milk is heated to a high temperature for a brief period of time, is effective at inactivating H5N1, as well as other bacteria and viruses that could make someone sick. FDA and USDA have worked together to test milk and dairy products purchased straight from grocery stores and have detected no live virus in these products. I'll leave the additional discussion about milk and its safety to my colleagues at FDA for them to cover. All the samples that are tested and collected for the detection of H5N1 are analyzed further using PCR testing. These gene sequences can tell us about why this particular strain of H5N1 was able to move into dairy cows and whether the virus has adapted to this new host. The gene sequences are shared in real time with USDA, CDC, and FDA scientists, and a bit later with other scientists through publicly accessible research portals. Sharing this information is how we can ensure that different agencies, whether they focus on animal health or human health, stay aware and aligned in a whole government approach to this disease outbreak. To talk a bit about the risks that H5N1 may pose to people that work directly with cows or live in their communities, I'd like to hand the conversation over to Dr. Shaw from the Centers of Disease Control and Prevention.
Thank you so much. Thank you so much, Dr. Debo. Now I'd like to introduce Dr. Nirav Shah, CDC's Principal Deputy Director.
Great. Well, good morning, good afternoon, good evening, everybody. Thank you so much for joining us today. Right up at the top, I'd like to thank Dr. Pata and the entire team at WebMD for their partnership in helping us co-host this event. Communicating with the public about what we know, what we don't know, and what we're doing to find out so that you and your family can stay safe is a top priority at CDC. And we thank you for helping us convene this forum and for that partnership. Now that you've heard from Dr. Diebel, my colleague at USDA, about what's going on with respect to H5 in cows, you might be wondering what this all means for you and your family. So I'd like to spend some time talking about what H5N1 or bird flu means from the human health side. Right up at the top, right now, CDC's assessment is that the risk to the general public from bird flu is low. And that is in part because it's rare for people to get infected with bird flu viruses, but it has happened. If and when it does happen, it's most often through direct, unprotected contact with infected animals. For example, not wearing gloves, face masks, or eye protection. And as you can see on the graphic here, now this is a graphic pertinent to poultry, people can become infected by breathing the virus in the air or by touching surfaces that are contaminated with the virus, and then perhaps touching their eyes or nose or inhaling those viral particles directly. And this is how humans can be affected by a virus that has often been circulating in birds and now more recently in cattle. Although the way that humans might be affected from cattle is likely not to be through this mechanism, but more likely to be through the milk. Now, for the last 20 years, CDC has worked here at home and abroad to prevent, detect, and respond to bird flu. Over the years, we've seen flu move from birds to other animals. And as Dr. Diebel noted, this year, we saw it move into cows for the first time. Since learning about these affected dairy cows back in March, we at the CDC have been working closely with USDA, our other federal colleagues, and with your local and state health departments to closely monitor individuals who have had direct contact with infected cows, specifically farm workers, to be on the lookout for any signs of illness. Now, on April 1st of this year, CDC reported one human case of bird flu in a dairy worker in Texas. This person's only symptom was eye redness or conjunctivitis. And after testing positive, this person was provided a medicine, an antiviral medicine, and thankfully made a full recovery. There have been no new or additional human cases since this individual in Texas. And again, at this time, the risk to the public is low. But as in any outbreak, this is an evolving situation and things could change. And that's why CDC is taking aggressive steps to make sure Americans stay healthy and informed. Right now, one of our top areas of focus is around farm worker safety and protection. Specifically, making sure that workers have access to personal protective equipment or PPE, specifically things like gloves or goggles or face masks, which can help reduce their risk of exposure if they happen to be working around affected cows. As I also mentioned, we're monitoring individuals who have been exposed to sick animals and then working with health departments in your state, in your city, and in your county to make sure that any farm worker who's been exposed and who happens to be showing symptoms are quickly tested for bird flu, along with other viruses that might make them sick around this time of the year. And again, thankfully, we've only seen one worker who's tested positive this year. In addition to that, scientists in our laboratories here at CDC are looking closely at the bird flu viruses to see if there are any changes in their DNA that might tell us if these viruses are able to spread more easily to people, between people, and importantly, whether they might be causing more serious illness. So far, and reassuringly, we have not spotted any such changes, but the CDC remains on the lookout. Now, the CDC doesn't do any of this work alone. We are in constant communication and working closely with our colleagues across the federal government, including the colleagues who have joined me here today. we're also in constant communication with state and local public health partners, specifically the public health partners in places where we've found affected herds, but across the country. What you're seeing right now is science in action. And we at the CDC across the US government will continue to keep everyone updated as this situation evolves. Thank you so much. Dr. Potok, back over to you.
Thank you so much, Dr. Shah. Before we hear from our two remaining speakers, I'd like to spend some time answering questions that we're receiving from our viewers. So the first question is for you, Dr. Shah. You mentioned that the person who tested positive in Texas only had eye redness. What other symptoms of bird flu should people be on the lookout for?
Well, no, thank you for that question. You're right. The individual in Texas did have eye redness, or what's called conjunctivitis. And that was an interesting finding because some of the individuals who had previously tested positive for bird flu had more symptoms that were more typical for what we would all consider flu. Things like a cough, a fever, muscle aches, feeling tired. This individual's only symptom was redness in their eyes. And the reason that's important is that it's a reminder that viruses are constantly changing, and thus we in public health have to constantly be on the lookout for any signs and symptoms that may be new. What folks out there should remember is, one, the overall risk to the public remains low right now. That said, if you happen to work around animals, whether it's chickens, whether it's cattle, or whether it's pigs, and you develop signs and symptoms that might otherwise be the flu, it's important to make sure you call a healthcare provider and have a conversation with them. They can then loop in the broader public health partners.
So thank you. That's really helpful. So then to follow, is there treatment available for people who do get sick with bird flu?
The answer is yes. And I want to take a minute to pause and note that there are many reasons why the current situation that we're facing with bird flu differs from what we might all remember from 4 years ago with COVID. We are in a much different place because of over 2 decades of investment into planning and preparing for things like influenza, particularly influenzas like this. As a result of that extensive planning and preparedness, there are medicines in place. Indeed, the individual in Texas who we've talked about was provided one of those medications. These medicines, if given early, can reduce the severity of illness as well as the duration of illness. And this is just one of many ways in which where we are with influenza and bird flu differs from what many of us remember from 4 years ago.
So this follow-up question is for Dr. Diebel. What should people and schools do if they house chicken coops?
Well, thank you very much for an interesting and important question. Avian influenza has been a concern for those who raise poultry, both recreationally and commercially, for decades. The current outbreak that we're working with now has been ongoing for 3 years. And there are many resources available for those folks who are keeping chickens, again, either commercially or recreationally in their backyard or in a local school. There are resources available to them to help them keep their flock safe. You can make sure that everyone here has links to the USDA website that have appropriate protections and appropriate guidelines for everyone to follow to keep their feathered friends healthy.
Thank you, Dr. Diebel. Bouncing back to you, Dr. Shah. The next question is, will the annual flu shot protect people?
One of the reasons we're focused on this is that, unfortunately, the flu shot that you maybe got late last fall or last winter doesn't do a great job at protecting you against what we're talking about here, avian flu. And that's because even though they both are flus and are basically the same virus, they differ just enough to where the flu shot that we hope everyone gets doesn't do a great job at protecting you. It might do a little bit of work, but it's not enough to take you to the bank. And so, although I definitely want people to keep getting their flu shot, what that is protecting you against is seasonal flu. What we're talking about here is something a little bit more novel. Thankfully, we're not just waiting for something to get worse. CDC and our colleagues across the federal government continue to work to make sure that we have the building blocks of viruses against flus like avian flu ready to go if we need them. Thankfully, we're not there quite
And what development or finding would suggest a growing risk to the general population? Thankfully, you said we're not quite there yet, but what are you sort of tracking?
What are we on the lookout for? Well, I'm glad you asked that, because this is an example of where those 2 decades of sustained investment, coupled with the playbook that we have based on the experience working on this for decades, puts us in a position to spot changes. So let's talk about what those are. Our teams are constantly monitoring to see if the way in which bird flu operates changes in any way. We're on the lookout, for example, for an increase in visits to emergency departments, or an increase in laboratory tests that doctors might be ordering that might signal a cluster of cases. We're also more recently looking at wastewater to see if there are changes there. And if we were to see more people getting sick, or more people getting severely sick, or chains of people. For example, someone who develops bird flu but doesn't have any connection to a dairy farm. That would be a point at which we'd like to escalate the situation. Thankfully, we have not found those, but we have teams of individuals here at the CDC working with systems that have been developed and a playbook that's been developed over decades, so that we are constantly on the lookout for these changes.
Thank you. And the next question is for Dr. Diebel. How do producers know when their sick cows have recovered and are virus-free?
Thank you. That's a wonderful question. So the signs of H5N1 in cattle are a precipitous and sudden drop in milk production and a general malaise, or signs that the animal just isn't feeling well. Generally, over the course of about 2 to 3 weeks, most animals recover with supportive care. Their milk volume returns to normal, and they appear healthy and continue to feed as they did before they had become sick. USDA is offering free testing to all producers who are interested in confirming the health status of their animals as they recover. Many of the tests that USDA conducts every day are in service of helping producers understand the health status of the animals in their herd and making sure that those animals are recovering.
Thank you. And I have one more question for you, Dr. Diebel. Could you talk a little bit about infected cats on farms? How should people be thinking about caring for their pets?
Well, that's a wonderful question. And as a cat owner myself, it's a concern to me as well. So far, we have no reports of infection of pet cats that an individual may be keeping in their home or that they may have in their neighborhoods. We do have reports of H5N1 in barn cats. Again, those with very high exposure to cattle that we know to be affected by H5N1. I think it's probably very prudent to keep your domestic cats, your beloved pets, home where they're safest. And if you are in an environment in which there are cattle, to keep them away from those cows to the greatest degree that you can. Again, we only know that this disease is in 49 herds across 9 states, and all of the producers that are affected know that their cows have been sick, so they can take appropriate steps in order to ensure the health and safety of their pet animals and their barn cats.
Thank you again to Dr. Diebel and Dr. Shah, and thank you to our viewers for engaging and submitting these very thoughtful questions. I'd now like to turn to our final 2 speakers. I'll start by introducing Dr. Dawn Prager, Acting Director for FDA's Center for Food Safety and Applied Nutrition.
Well, thank you very much. It's certainly a pleasure to be with you here today. Just to say again that we're working closely with our colleagues at USDA, CDC, NIH, and other government agencies, as well as the dairy industry, academia, and states to understand this evolving situation. What we want to do is to share a variety of the sampling and tests and other activities that we're doing to determine that milk is safe and that dairy products are safe. To date, all of our testing and evidence indicates the pasteurization process works and that the commercial milk supply is safe. I just want to take a few minutes to discuss pasteurization. Pasteurization is a process that kills harmful bacteria and viruses by heating milk to a specific temperature for a set period of time to make milk safe to consume. It's a process that's helped ensure the health of the American public for more than 100 years. Indeed, we're celebrating the 100th year of pasteurization this year. Even if the virus is detected in raw milk, pasteurization is generally expected to eliminate pathogens to a level that does not pose a risk to consumer health. Now, let me tell you about what FDA has tested to understand the effectiveness of pasteurization against the FDAI virus, or this strain of bird flu. We tested 297 pasteurized retail dairy samples, including milk and other dairy products such as cottage cheese and sour cream from across the country, and determined that no live virus was present in these products. These test results confirm that pasteurization is effective against the virus and the commercial milk supply is safe. Additional sampling and other surveillance activities, of course, will continue. FDA will continue testing to keep understanding the effectiveness of pasteurization at inactivating the virus in milk and other dairy products. While the commercial milk supply is safe, we continue to strongly advise against drinking raw milk or milk that has not been pasteurized. We also recommend that industry does not manufacture or sell raw milk or raw milk products made from cows showing symptoms of illness. The FDA and CDC have longstanding information regarding the increased risk of foodborne illness for both humans and animals that might consume raw milk, and you can find additional guidance on our website on raw milk and milk handling. So we're continuing our response activities, of course, at deliberate speed. And again, the evidence to date continues to indicate that the commercial milk supply is safe. We're committed to transparency in the evolving situation, and we'll continue to provide updates regularly, and you can find additional information on our website. Happy to answer any questions.
Thank you so much, Dr. Prater. Finally, I'd like to introduce Dr. David Boucher, Director of Infectious Diseases Preparedness and Response at ASPR.
Thanks a lot, Dr. Papak, and good afternoon, good morning, everybody. Before I get started, I just really want to thank the teams here at WebMD and CDC for hosting this webinar, and thank you all for taking the time out of your day to join us here and talk a little bit more about avian influenza. At the Administration for Strategic Preparedness and Response, or ASPR, one of the major goals we have is to develop and stockpile the medical countermeasures that the country might need to respond to a wide array of potential threats to our collective health. As you heard from my colleagues at USDA, CDC, and FDA, we're not facing a new pathogen here in H5N1 influenza. We know influenza, and even though the virus circulating in birds and now cows is different enough from the seasonal strains of influenza that we see each fall and winter, it is still influenza and an enemy that we all know very well. What that means for us is that we do have tools ready to go now. Antivirals, medicines, that Dr. Shah mentioned, and a lot of different types of personal protective equipment. And we have approved vaccine forms to give us that blueprint to attack this virus. Because of some of the preparedness work that ASPR's normal book of business has, we have the building to manufacture vaccines if they're needed. I'll get back to vaccines in a bit, but I'll first talk a little bit more about personal protective equipment, or PPE. Because of the stockpiling investments that ASPR made during the COVID response, we have a good supply of gloves, goggles, face shields, N95 masks. Those PPE pieces that Dr. Shah mentioned, those are all available in the strategic national stockpile that is managed by ASPR. As Dr. Shah also mentioned, all of these can reduce the chance of infection for our agricultural workers who may be close to infected animals. Our colleagues at CDC and USDA have developed guidance for proper use of PPE for workers who may be at risk of exposure. All of these PPE products are, of course, also available on the commercial market, and many of our states across the nation have PPE that they're making available to the agricultural community. At ASPR, we have been with our partners in public health at the state, territorial, local, and tribal levels to make sure that they know that we can also be a resource to them as they work with their communities to ensure that PPE is available. All of this really is to say that they're available or access should be a barrier to the proper use of PPE to reduce reduce chances of spillover of this virus to people. The next thing I'll touch on is antivirals. Again, influenza, not a new virus for us. When we look at this particular strain of influenza that's in cows right now, we're not seeing any of the genetic markers associated with resistance to our wide range of FDA-approved antivirals. What that means is that the same antivirals that we take for seasonal influenza would also be available if needed to treat H5N1. Within the Strategic National Stockpile, ASPR has a large quantity of oseltamivir, which you may have also heard of as Tamiflu. This is the most commonly prescribed influenza antiviral. Oseltamivir is, of course, also widely available, and we aren't seeing any supply issues. We do have tens of millions of courses as a safety net that can be sent to states throughout the country if we need them. We also have supplies of 3 other antivirals for influenza. That's zanamivir, ramivir, and baloxavir. Like oseltamivir, we would expect that all of these antivirals can be tools for us if we do see additional human cases. As Dr. Shaw mentioned, still just one case, but we are ready if we need these. Last thing I'll touch on is vaccines. Before I do that, though, I also really want to underscore what you heard from my colleagues earlier. The risk to humans posed by this virus is low. We are not at a spot where vaccination is recommended for anyone. But that said, our job here at ASPR is to be kind of that twitchy group that is ready to move if that changes. To make sure that we're in that crouched and ready position, we manage a program called the National Pre-Pandemic Influenza Vaccine Trial Program. It's a little bit of a mouthful, but it's a fairly simple plan, actually. Basically, what we do is we're constantly working with our partners at CDC and looking out for influenza viruses that are just a little bit different from the things that we've seen in the past. When we do see something a little bit unique, we develop those building blocks of a vaccine against that virus. And when I say building blocks, what I'm talking about are really 2 things. First, that piece that mimics the shape of the virus, so that when a person is vaccinated, they develop antibodies that can attack that structure if they see it again in the future. This is what's called the antigen part of the vaccine. The second piece is the adjuvant, and that's the part of the vaccine that kind of turbocharges the immune system so that it really reacts to the antigen in the vaccine and builds up that protection you want to get out of vaccination. When a vaccinated person sees that structure again, possibly in the form of a live virus, our bodies are primed to fight. We have a head start on fighting off infection and reducing the negative effect of that virus on our health. The good news here is that this preparedness system has worked the way we hoped it would, and we do have an initial supply of the building blocks we would need if we needed to vaccine for the virus that we're seeing today in birds and cows. We also have great partnerships with the manufacturers of seasonal influenza vaccines, and by working, we can pivot quickly to large-scale manufacturing if it's needed. So that's really the story on the vaccine front. I just really want to close this part by confirming again the current risk is low. Vaccines are not part of our response right now. They're very much part of our preparedness so that we at ASPR can be if we're called upon. So again, thanks so much for spending a little time with us today. Dr. Patak, I'll pass back to you.
Thank you again, Dr. Boucher, and thank you to all of today's speakers. I'd like to spend the last bit of time we have together answering some more questions from our viewers. So we'll start with you, Dr. Prater. Can you talk a bit more about food safety, especially for people who do people need to do anything further when they're preparing food like eggs?
Thanks very much for the question. I think with respect to food safety, one of the things I want to really be sure to reiterate is that based on all the evidence that we have now, the commercial pasteurized milk supply is safe. Many of the cheeses and other types of products available on the market to consumers are also made from pasteurized milk, so that's a good thing. With respect to eggs, the likelihood that eggs from an infected poultry facility are found in the retail market is low, and proper storage and preparation reduce the risk. In 2010, FDA participated in a joint risk assessment with USDA's Food Safety Inspection Service to examine the human health impact of bird flu and poultry shell eggs and egg products. And this risk assessment determined the risk of humans becoming infected with bird flu through the consumption of eggs contaminated shell eggs is low. For instance, when a case of bird flu is detected in the U.S., the chance of infected poultry or eggs entering the food chain is low because of the rapid onset of symptoms in poultry, as well as safeguards that are in place, which include testing of flocks and federal inspection programs. Additionally, when food is properly prepared and stored, the risk of consumers becoming infected with bird flu is reduced even more.
So much. The next question is coming in for Dr. Boucher. If you could speak a little bit about states, if they don't have access to what they need with regard to being prepared and protected, what can they do?
Sorry, that's a great question, and thanks for it. The states have a couple of different things. I mentioned a lot of the products that we have in the Strategic National Stockpile are available on the commercial market. Many states have their own stockpiles of oseltamivir, personal protective equipment that can be made available to those who need it right now. As a backstop for that, a refill if we need to. The Strategic National Stockpile is available again with antivirals, oseltamivir, baloxavir, zanamivir, peramivir, and personal protective equipment. We are seeing a couple of orders for goggles, face protection. Also have gloves and N95s available if needed. We work closely with our public health partners, and thanks to the great work that we're doing, that USDA is doing with us, we are marrying public health and agricultural communities so that those who need it know how to access PPE and antivirals through the Strategic National Stockpile.
Thank you so much. We have a question coming in from Dr. Shah. So you mentioned a variety of surveillance strategies, wastewater being one of them in your remarks. Where can people go to learn more about this strategy?
Great. Thank you. Now, with respect to wastewater, the best place to go to learn more about all of the work that CDC is doing around wastewater is to go to your favorite search engine and type in CDC wastewater dashboard. And that will take you to the portion of our website where we talk about what we're doing to use wastewater to get an early look at what might be happening, not just for influenza, which is what we're talking about today, but a host of other viruses, whether that's COVID, as well as other things that we are learning how to detect. I'm going to talk a little bit about wastewater here, but let me first start by noting that our wastewater architecture is another example of what sustained investments in public health get us when it comes time to something new. The wastewater architecture that we have was developed through the course of COVID based on investments that we received. And now, in light of influenza, bird flu, we're able to pivot by using that architecture for another virus. So this is a good example of why investing in platforms is really important rather than investing disease by disease. So what have we seen with our latest round of wastewater? Well, earlier this week, CDC announced and put results on our website from the first round of sites across the country, over 200, that have been regularly testing for influenza in their wastewater. Now, what they're testing for is influenza as a family of viruses, not the specific virus that we're talking here, but a broader, bigger umbrella of all influenza viruses, or a lot of them. And what we found was that 3 particular sites, or about 1% of the ones that we're testing right now, came in at levels that were what we consider to be high. Now, we don't just stop there. When we see these signals, we do what we always do in public health with a signal, and that's to investigate. We should be alert, not alarmed. And indeed, in this situation, we took those signals and went several layers of the onion deeper. We looked at what was going on with emergency departments, as well as with laboratory tests that doctors were ordering, to see whether there was any corresponding increase on the human side. Reassuringly, we haven't seen those signals on the human side. And so again, we don't stop there. We're working with officials on the ground to understand what might be causing these increases. Perhaps it's something related to the cows themselves, Or maybe it's the milk that might be disposed of in a regulated, permitted manner that is working its way into the water system and then to the wastewater system and then causing the increases that we see. Thankfully, again, we haven't seen anything corresponding on the human side. We're going to keep that dashboard updated every week, and I encourage everyone to take a look at it and keep up to date with what's happening.
So I think it's really important what you said with regard to being the general public being alert and not alarmed. So my question for you is, in terms of being alert, what should the general public be doing right now with regard to listening for information?
Well, the most important thing, I appreciate that question because that's right. We at the federal level are responding. But for the public, what we want folks to do is to be following along. And what's critical when it comes to keeping up to date with the changes here, it is relying on trusted sources of information. The websites of the agencies of all of my colleagues here, whether it's the CDC, whether it's the USDA, whether it's FDA, or our colleagues at ASPR, are continually updated with the latest and most trusted information. If you're looking, for example, for the latest information on how many herds of cattle have tested positive, the USDA's website, specifically APHIS's website, updates that information with an easy-to-use map every single evening. Likewise, at CDC, we update our website, and indeed every Friday, we put up a roundup of the latest news from the past week, including with things like wastewater. Similarly, our colleagues at FDA and ASPR. So the most important thing, Dr. Patak, is not just to stay informed, but to do so via trusted sources of information. And I'm proud and pleased with the work that our federal colleagues and I have put together in a manner that we can keep that information updated.
Thank you so much to all of our speakers. With that, we've reached the end of our time together today. Thank you again and again to our speakers and our viewers who are tuning in and sending such thoughtful questions. I hope you found today's information helpful. Like any outbreak, the bird flu situation is one that is still developing, and information is being updated as we continue to learn more. I encourage you, as Dr. Shah said, to visit our federal agency partners' websites to stay up to date on the latest information. Thank you so much for joining us today.